Orthopedics, hand and wrist, is a median artery, vestigial median artery demonstrated carpal tunnel release. Arthrodesis of the wrist, good operation. Arthroscopy of the wrist, traction, your assistant provides the traction. AVN of the lunate, Kienbock's disease. Carpal tunnel syndrome, waist and thenar area, surgical release. Transverse carpal ligament reform, demonstrated MRI. This rarely occurs but can occur. Good tractions required for carpal tunnel release. Here are the landmarks and the anatomy, in particular the proximal and distal arterial arcades. Severe claw hand, could be Dupuytren's, could be ulnar nerve problem. Congenital accessory hamate. Congenital bilateral PIP deformities of the hand. This is quite unusual and rare and quite traumatic, very difficult to correct. Need to see a hand surgeon. Mandolung deformity, post-traumatic of the hand. Inclusion cyst, digit, dorsal, can recur, can be problems closing the skin, demonstrated here. Dislocated carpo-metacarpal joint. He's a strapper dealing with horses. Dislocated third metacarpal joint here in a young child. Easily reduced, but there's also associated fractures, could distract from 3 injuries in one. Here it is, fixed dislocated CMC joint, reduced and held. Dislocated PIP joints, don't underestimate those, take them seriously, because they may be incompletely reduced or remain unstable. Dislocated thumb, they have ruptured ligaments. Dislocated first CMC again. MCP, dramatic, easily reduced, but don't forget the ligaments, they may need repair. Dislocated carpo-metacarpal joints, easily missed near the true lateral of the hand, easily overlooked, unstable, can reduce, but they fall out again. Dislocation of the DIP rotatory. Dislocation, 41-year-old male, look how the lunate's looking backwards. Dislocation of the lunate, not the normal anatomy, lateral, look. The concavity upper lunate's empty. So the lunate's rolled forward. Painful wrist or sprained wrist with median nerve compression. So be very careful. Don't miss these. Dislocation MCP joint, little finger. Dislocated CMCs, unstable, we have to hold with K-wires or plates. Perilunate dislocation of the wrist, again lunate sitting forward. The lunate sitting there, hold of the wrist is moved backwards. Rotatory subluxation, the PIP joint. Rotatory subluxation, the scaphoid. Let's move forward. Dupuytren's, post-correction, able to get his hand flat on the table. Excision of Dupuytren's, gentle S incisions, take your time. Beware the digital nerves and get a good result even with a PIP joint. Dupuytren's pre-op, take your time and get a good result, and patient very happy. Dupuytren's affects the little finger, ring finger. Good surgical correction. Look at this degree of contraction, you may actually have to amputate this little finger. Severe involvement in the PIP joint. These are band and cords at time of surgery being excised. There is good correction on the table. Dupuytren surgery. Severe contracture, 65-year-old. There's planning the incisions. Taking your time, there's an amputation, little digit, and away it goes, a little finger off there. That's a contracture pre-op. And again, so it's not only down, flexed, but also rotated. And there it is, finger lying free on the table. You won't notice it. Most people can't count beyond 3, so contour the hand. There it is, looking good, post-op healed, back to work. foreign body, wood in the hand. Beware of these, often little fragments left. You've got to be thorough, take the patient to theatre a couple of times, make sure all fragments are out. Ultrasounds can be very useful actually in showing the fragments where there's persistent pain and swelling after a relatively minor injury. Fracture second metacarpal head, not unusual from fighting. Bennett's fracture child, fracture of the capitate hamate, Colley's fracture, dog bite little finger, try to preserve the finger, debride, leave open but stabilise with K-wire. Fracture dislocation of first CMC joint. This is a difficult fracture of the DIP, or the DIP. Fracture dislocation and Dupont's, both combined. Fracture here involving the DIP joint. And there it is, back in position, held well, K-wires, went on to healing. Fracture dislocation of the wrist held with K-wires. Severe fracture dislocation of a 21-year-old, so there's going to be a lot of carpal injuries here, as well as the radioscaphoid injury. Here it is, back in position, close reduction held with K-wires, but just check for any scapholunate dissociation here. It looked rather dramatic, initial presentation came back well. Fracture distal phalanx, distal radius, often you get back, will be unstable, have to hold K-wires or maybe a plate. Distal radius, fracture of distal phalanx. Is fracture of mid-radius ulnar, often said to ORIF, but here managed non-operatively. It is possible, you know. Fracture of the hook of the hamate, there, golfers. Fracture of the fifth metacarpal, can be an altercation in the hotel. They can be difficult to hold. You get a lot of remodeling, so you have to actually advise that it will remodel with time, but you'll get a bump, it will heal. There's a dog bite fracture, it went on to healing, 1K wire. Fracture involving the middle phalanx there, involving the PIP joint, very difficult to deal with and fix, held K-wires. This particular fracture went on to a malunion, limited extension here, so may need to do a little osteectomy. Fracture of proximal scaphoid, fracture of scaphoid wrist, big gap here, need bone grafting and fixation. Fracture distal radius. Here's a plate fixation, fracture distal radius with this new volar locking plate. Use of external fixateur for a fracture of the thumb. A dramatic slicing or degloving type injury of the palm. Did well, just a little bit of necrosis around the skin edges. Fracture dislocation first CMC joint, put back in position, hold with K-wire. Open fracture first metacarpal, circular saw injuries. Try to preserve all length, these will do well, just take your time. And here he is, got a good result, preserve the length. External fixateur on, scaphoid, electrical implants been put in there for slow healing the scaphoid. There's the external fixateur applied to the open fracture of the thumb. Amputation at the proximal level, long finger, traumatic. Bennett's fracture down here at the base of first metacarpal. Fractured cast for wrist, allowing exercise to be done. Chainsaw injury, beware of involvement into the joint. This is the end of part 1, please look out for part 2.